So our next question here: what do you think is the most common misconception about dental health?
Yeah, over the years now, what I hear people say, thank you so much for that question, Lydia. What I've heard people say is that what cause the cause of holes in teeth
Yeah.
is worms. All right. In fact, people go all around to all these traditional charlatans, and they do some magic and bring worms out of their mouth. It is wrong. Right? What causes tooth decay is microorganism that we can see with our eyes. So I think perhaps we should do another session to talk about a video to talk about this.
Okay, Dr. Dan is going to tell us more on that.
Okay.
So our next question:
Okay.
what advice would you give to someone who wants to maintain a healthy teeth and gums?
Okay. Early teeth and gum. First off, your routine clinic. You know, you brush in the morning and the last thing before you go to bed. Very fundamental. All right. Prevention is not just better than cure. It is much more affordable. When you brush in the morning and at night, you also get to see your dentist every 6 months. Very, fundamental. You got to have, an amazing healthy gums from that. Okay. Thank
That
you.
was very nice
Yeah.
from Dr. Dan. So we have our last question for you today. What advancements in dentistry are you most excited about right now?
You see, every day, in fact, the constant thing now, as we know, Lydia, the constant thing we know in life is change.
Yeah.
In dentistry, we also see the reflection of that. But one beautiful thing about our age now is that change is happening at a very rapid rate. So if you want to be at the cutting edge of your profession, you've got to be in tune with what is happening. So for dentistry, there are so many things I'm excited about.
Okay.
First off is that I want to be able to do a crown and deliver it immediately.
Yeah.
All right, the 3D scanning now. You do a prop, you scan immediately, and they fabricate a crown. I'm looking forward to that, to be able to practice and fabricate crowns immediately. The first that will be the first. Then also, I know in the Western world it's popular. People are beginning to do the profile scaling and polishing. I'm looking forward to the technology becoming much more available in the sub-Saharan Africa, where we'll be able to do scaling and polishing, not with the routine scaling, but with the profile, hair brushes. Uh,
I actually thought about something about what he said. In the aspect that patient comes for treatment and you're to replace the teeth, I think an advancement in technology will actually be nice if the patient doesn't have to go and come back to actually get the permanent teeth. I think it would be nice for you to actually fix the teeth and the patient goes home.
Yeah,
What do you think about
yeah.
that?
You're very correct, Lydia, and I think that's where we are going. A lot of this is being done in the UK and the US, but we are in a very low resource part, of the world. But I think we're going to get there. The patient comes in the morning, they want their crown, and they get in it immediately. All right, and that's it saves cost, it
Yeah.
increases productivity. The patient is happy, and the dentist and the dental professionals are also happy. So I'm looking forward to a time like that in Nigeria. Yeah.
So that was very nice from Dr. Dan.
Thank
So
you.
we've come to the end of this section. Do well to like, comment, and share. Stay tuned for the next episode.
Thank you. Thank you, Lydia.